Okay, let's unpack this. You know how sometimes you're wading through loads of information just hoping to find that key insight that makes it all click? Well, that's what we're doing today. We're taking a deep dive into something affecting millions, the actual real-world financial hit of managing a chronic disease. Specifically, we're zeroing in on type 1 diabetes, T1D, and the pretty significant out-of-pocket costs people face. We're using a really interesting recent research paper that looked closely at the situation in Turkey, focused on real people, real costs. Our mission here is to pull out the crucial bits, maybe some surprising facts, and help you understand the true burden, not just in lira or dollars, but, on everyday life.
Exactly. And what's so striking, I think, about this Turkey study is how it holds up a mirror to a global problem. The paper itself points out chronic diseases. They're responsible for something like 74% of all deaths and 80% of disabilities worldwide. It's huge. And the money side, well, it's estimated about 100 million people every year get pushed into extreme poverty just because of high out-of-pocket health costs. Type 1 diabetes is kind of a perfect storm for this. It's chronic, needs constant, lifelong care, daily monitoring, insulin checkups, careful nutrition. Plus, and the study makes this point too, new high-tech devices. They're expected to drive costs even higher.
That global perspective really sets the scene, doesn't it? And before we jump right into Turkey, the paper also throws out this staggering figure for the U.S. Diabetes cost, what was it, $327 billion back in 2017, with a huge chunk being direct medical expenses. Makes you immediately wonder, okay, what does that feel like for just one person, one family?
Precisely. And if you look at the trends, direct treatment costs for diabetes in the U.S., they've apparently jumped 240% in the last decade alone. Just glucose management costs, for instance, went from about $17 billion to nearly $58 billion. That's enormous. We've seen studies elsewhere, too, like in India, showing how these direct costs can just devastate families, especially lower-income ones. So that really frames our question for this deep dive. What does this financial pressure really mean at the household level? Let's see what this Turkey study found.
Perfect segue. Okay, so this specific research in Turkey, they reached 279 people with type 1 diabetes. It was quantitative, used an online survey, end of 2024. What jumped out at you about the participants? The demographics must tell a story.
Oh, they absolutely do. It's quite revealing. First, a majority were female, about 56%. But what's really striking, I think, is that almost three-quarters, 72.4%, were kids under 18. And get this, over 90% were diagnosed as children. So you're talking about a lifetime burden starting very young for most. The average monthly household income, around $4,427 US dollars. And here's a key finding, maybe the most telling. A huge 81.7% said T1D products were excessively expensive. And almost the same number, 81.4%, said these costs significantly impacted their finances to the point they had to cut back on other things.
Wow. Okay, over 80% feeling that significant hit. That's massive. So given that average income, you have to ask, how do they manage? Where is the money actually going each month? What were the big cost drivers?
Right, that's the crucial question. The study calculated the mean total monthly out-of-pocket spend at $339.94, which, adds up. That's over $4,000 a year. And it's important to remember, this generally doesn't include the cost of insulin itself. In Turkey, that's mostly covered by the government, unless you buy it off script or without Social Security.
Okay, nearly $340 a month, excluding most insulin. Still a very significant chunk for many families. So within that $340, where did most of it go? What categories ate up the budget?
Yeah, the breakdown is really where you see the pressure points. The biggest category by far was consumables. That came in at a whopping $205.84 per month on average.
Okay, consumables. What falls into that?
Well, this is mainly the high-tech stuff. Continuous glucose monitor sensors, CGMs, averaged $182.41 just for the people using them. And insulin pumps, for those who use them, averaged $170.77 a month. Then you also have things like insulin needle tips, about $10.73, and glucometer strips at $17.40. But really, it's those CGM sensors and pump supplies driving that huge consumable cost. They make up almost 2/3 of the total out-of-pocket expense right there.
Wow. So the technology is the main financial burden. What came next?
Next up was hospital expenses. That averaged about $113.90 a month. That covers things like routine doctor visits, specialist appointments, and also dietitian services, which are pretty crucial for T1D management. Then came healthy living costs at about $82.62 monthly. This is for things like specific nutritional needs, maybe special foods or costs related to exercise. And finally, you had sort of other expenses at $41.24 and transportation costs getting to appointments and pharmacies at $33.14.
Yeah.
But yeah, the headline is definitely those high-tech consumables dominating the spending.
Those numbers are stark, but maybe putting it as a percentage of income really brings it home for you, listening. What did the study find there? How much of a family's total income was going just to manage T1D? I bet it's high.
It is high. And this really hits at the sustainability issue. On average, these individuals were spending 30.4% of their entire monthly household income just on diabetes management.
A third.
Yeah, nearly a third. And think about this. If someone was earning the minimum wage in Turkey in 2024, which is about $486 a month, they'd be spending almost 70% of that.
70%.
70%. That $339.94 out of $486 is, well, the paper uses the phrase profound destructive effect on the household economy. You can imagine the incredibly tough choices families are forced to make.
Profound destructive effect.
Yeah.
Yeah, that paints a powerful picture. So, okay, these high-tech devices, the CGMs and pumps, they're clearly breaking the bank for many.
Yeah.
But are they worth it? Did the study look at whether they actually improve health outcomes despite that huge cost?
That's the other critical piece of the puzzle, and it creates a real tension, right? The study did find that people using CGM sensors had significantly lower average HbA1c levels. That's that key measure of long-term blood sugar control. Their average was 7.33% compared to 8.22% for non-users. Lower is better, so that's a meaningful difference.
Okay, so the CGMs seem to help control. What about pumps?
Interestingly, in this specific study, insulin pump use didn't show a statistically significant difference in HbA1c compared to non-pump users. However, looking at the overall picture, there was a weak negative correlation. Basically, as total spending on diabetes management went up, HbA1c levels tended to go down slightly. So it suggests that, yeah, investing in these more expensive tools, especially CGMs, probably does lead to better health results, even though the cost is such a barrier.
That's fascinating. The very things that improve health are the most costly.
A tough paradox.
So how is the policy landscape in Turkey trying to deal with this, given the costs and the health benefits you just mentioned?
Well, like many places, they're trying to adapt, but it's complicated. Globally, reimbursement for things like CGMs varies a lot. In Turkey, there's a new policy coming into effect in 2025. It's set to cover the monthly cost of CGM sensors up to a certain limit, about $100 under Social Security.
Okay, that sounds like a positive step.
It is, but here's the catch. It's only for individuals with T1D who are under 18 years old.
Oh, only for kids.
Right. And remember, the study itself found no significant differences in either HbA1c levels or total out-of-pocket costs between the under 18s and the over 18s. So while helping kids is obviously important, this finding suggests the financial strain and the need for these devices to manage health effectively, well, they don't just disappear when you turn 18. The burden seems pretty universal.
Right, so the policy addresses part of the problem, but maybe not the whole picture based on this data. So wrapping this up, what does this all mean for you, the listener? This deep dive into T1D costs in Turkey really shows the sometimes catastrophic financial weight on individuals and families. The key takeaway seems clear. Managing T1D costs a lot out of pocket, especially for vital tech like CGMs and pumps. And cruelly, those costly items are also linked to better health. It's a tough spot.
It really is. The study makes it crystal clear. People are spending almost a third of their income, maybe much more if they're on minimum wage, just to manage this condition. And it leaves us with a really important question, I think. If we know these technologies improve health, reduce complications, potentially save costs down the line, and if we know the need doesn't stop at age 18, how far should healthcare systems go to make these essential tools truly accessible and affordable for everyone who needs them? What's the real long-term cost socially, economically, of not doing enough to support people living with chronic diseases like T1D?
That's a powerful question to think about. A complex challenge definitely for healthcare systems everywhere. This deep dive has, hopefully, given you a shortcut to understanding the very real, often hidden financial side of living with type 1 diabetes. We hope it makes you curious to learn more.